always say fibromyalgia. I have fibromyalgia, but fibromyalgia doesn't have me.
Love it. Love it.
So I think that the thing that helped me the most was even my doctor, just talking to my doctor about that, and them telling me, when you look good, you feel good.
It's
so
true.
even when you feel not so good, even looking good makes you feel good.
It is hard to break free from that, from living your life and being who you are, even if others will judge you because of that. Like, oh, well, she must not be that sick because she could put on some heels. And I saw a quote online that said, for chronic warriors, just because you did yesterday doesn't mean you can't today. And just because you can't today doesn't mean you can't tomorrow. Beautiful butterflies, and welcome back to my channel. If this is your first time, I'm Nina, and in this video I'm going to interview the lovely Lisy. She's a chronic warrior. She's going to tell us about her story and how she copes. So here she is.
Hello, how are you? My name is Lisy. I'm actually 43 years old. I actually have fibromyalgia, and I have a couple of herniated discs on my neck and my back, pinched nerves. Thank you, Nina, for allowing me to share my story with you.
How did you find out about these conditions?
It took me a very long time to find out what I had. I used to be a paralegal for a long time. I worked in the legal field, and at my job, I started feeling very sick. Couldn't get up. My body was hurting. Clothes were hurting. It got to a point where I was going back and forth to doctors. I think I missed an entire month at my job because I couldn't figure out what was wrong with me. They didn't know I was allergic to mold and allergic to all these other things. I had sinus infections I could not get rid of. Not even antibiotics were helping. My body was hurting to a point where a touch would just bother me. Clothes in the middle of winter, because it was winter time, so I had to wear open-toe shoes. It got to a point where I had to request a handicap sign while I was still in the process of figuring out what was wrong with me. I felt like I was dying. That's how I felt. Like I felt like I just, out of nowhere, I just couldn't be myself. Like my body was just not cooperating with me. I couldn't get up from bed. I couldn't sleep, and I was getting overwhelmed. I was taking every medication over the counter just so I can get some sleep, because I thought it was all up here, and it really wasn't. I'm like, what is going on with me? I was desperate. They even gave me was it Xanax? I went to a doctor, and they're like, try the Xanax. That wasn't helping. My aches were still there. At my job, there was a few other women that were feeling the same way. And I recall one day being in my department, and a coworker of mine came to me and said, you should go speak to such and such, because she has your same conditions and she doesn't know what's going on. So I felt the need to go and speak to her. It got to a point in my job where I would just stay in my desk. I wouldn't eat. I would have my bottle of Aleve. I would have a heating pad, and I just wasn't even having a social life with my coworkers, because I just wanted to stay in my desk, because I didn't want people to think, is she crazy? What's wrong with her, And because I was just dealing with the pain and the stress, the anxiety, depression, everything that came with it. So I went to speak to my coworker, and sitting there and her sharing her story and what she was feeling, it was like she was speaking what I was feeling. And she mentioned there's a couple of other women in the department, and one was just diagnosed with fibromyalgia. And I was like, fibromyalgia, what is that? Like, I had no idea what fibromyalgia is. I was actually going to a chiropractor because obviously I started with my neck issues, with the neck problem, but it was all just together. The pains in my neck, pains in my body. And I ended up going to an allergist. So what I did was Google. I did a lot of research. I was my own advocate. I sat down. I would sit there on the computer till 3, 4, 5 o'clock in the morning, obviously crying, because I felt helpless. I didn't know what was going on with me. Remember, with fibromyalgia or any type of illness, everything is dormant in our bodies. All it needs is like some type of trauma to pretty much, like I say, wake it up, like you say. And that's what happened. You know how hard it is to diagnose it.
It is. And it really is just a umbrella term for all the symptoms that we experience. There's no blood test. They go on our symptoms and, our history, but that's pretty much it, which is kind of hard. It puts people in a place of, on one hand, it's validating because it's not in your head. It's not something that you're imagining. But then at the other part of it, it's like, okay, so, where's that lead me? They still don't understand exactly what causes it. But like you said, there are many who have it, who have some kind of trauma or, that's associated with it.
Exactly. That's the thing. Thankfully, I had doctors that believed. I went to a rheumatologist here in Rockaway.
Okay.
And he actually, I think I had the epidurals and I had the trigger injections. Is that what they're called?
Right. Mm-hmm.
And I still had the body aches. Obviously they do all kinds of testing.
Mm-hmm.
I did acupuncture as well. I had pain management doctors also. So when I went to my chiropractor, he would send me to the pain management. He sent me to a few other doctors to get checked. And everyone came up with the conclusion that that's what it was the fibromyalgia after all the testing that I had done. Because my pains were still there after I got rid of the
things that they could see. That really just shows, medicine has made a lot of advances, but there's still limitations. People are experiencing so many different illnesses and conditions that they don't understand because it's like, well, I don't see it on the blood work and this x-ray.
But I also have 3 family members who have it in Puerto Rico. So I didn't know anything about it until. Okay. So again, like I said, it could be dormant and it could also be genetic. And I also went to a neurologist. So he did a bunch of tests. Now there was a test that he actually did to rule out any other conditions. It's a biopsy that they do in the ankle, and that's how they rule out other conditions. And that's what it came down to, the fibromyalgia at the end.
Wow.
Yeah.
I've never heard of that. So what they take, explain that biopsy, they take some of the tissue? Or?
It's like a little piece, with like a pencil. That's how they describe it. It's kind of like the point, the little size of a pencil point. And they take, I guess, tissue from there, and then they send it to the lab to see.
With all these conditions that you have, what limitations have they put upon you?
You know what? It's so unpredictable with fibromyalgia that you just never know what to expect. It puts a lot of limitations because one day you're like, hey, happy-go-lucky. You have all this energy. You're up and on the go and doing so much. And then, bam, the next day, you're limited to you just all types of limitation. You can't get up. You can't eat. You can't function. Everything hurts.
Right.
So it's like, it's unpredictable. You never know what to expect.
How did it affect your relationships?
It affected me in many ways. I think one of the hardest things for my kids was the fact that I just couldn't get up. I was in bed constantly in pain, crying, feeling helpless, feeling hopeless, because I had no idea. Although the diagnosis was fibromyalgia, you still feel like you're dying. Like there was so much that I was going through at the time that, the word, oh, you're sick. You don't want people to look at like you're sick. No, especially that you look okay,
Right. Which is its own struggle. Sometimes I feel like this where I'm not able to, I don't want to put myself together because then people will think, oh, you're fine. Like, do you feel like that? Or did you have people question your diagnosis because of how you look? Yeah.
All the time. I mean, I've always been known as Miss Fashionista, Lisy with her heels. At the beginning, I actually had a problem with that. I was dealing with that constantly. Oh, she looks fine. I would hear it, but then I've had people tell me, oh, but you look good. You don't even look sick. You're sick, but you're dressed up like that, or you're sick and you're here, and you're sick and you're doing that, or you're sick and you're wearing heels. Like, I think that the thing that helped me the most was even my doctor, just talking to my doctor about that and them telling me, when you look good, you feel good.
It's
so
true.
even when you feel not so good, even looking good makes you feel good.
Makes complete sense. And I think it also depends on the personality of the person. Some people who aren't sick aren't ones to always dress up or do certain things. For them, it's other things that makes them feel good. But for others, it's just something about it, like you even think of the fact that when you're depressed and you don't feel like doing your hair and you're just in your pajamas and you haven't showered or brushed your teeth, you don't necessarily feel good. But when you even do something as simple as wash your face, brush your teeth, take a shower, you do feel better. So
Mm-hmm.
it is hard to break free from that, from living your life and being who you are, even if others will judge you because of that. Like, oh, well, she must not be that sick because she could put on some heels. Instead of, you know what? You see Lisy with her heels on today, but you don't see her later on tonight or
Mm-hmm.
tomorrow. And I saw a quote online that said, for chronic warriors, just because you did yesterday doesn't mean you can't
Could do.
today.
Mm-hmm.
And just because you can't today doesn't mean you can't tomorrow.
Tomorrow.
How did you deal with how it affected your kids? Did you get help, or like how did you cope with?
Um, I did. I actually I went to a counselor. Actually, the counselor
Okay.
would come to my house. So
Oh, nice.
I was going through other things. My mom was also very sick, so I
Oh.
was going through my mom's
Mm-hmm.
illness and dealing with myself, uh, dealing with the fact that it affected my marriage, and I ended up getting divorced. So all of that affected me. Before I even got divorced, my kids were so affected to a point where I think these words always stuck with me, and this is why I ended up, I guess, fighting through my pains every day. Our kids are what motivates us. They keep, they keep us
They do.
strong. I don't know, that we find the strength where we do not know where it comes from when you have kids. It's just hard to explain. So
Mm-hmm.
my older son would lay in bed with me, and one day he said to me, "Mom," he's like, "I pray that God takes your pain away and gives it to me so you don't have to suffer anymore." And I was like, "Oh my God, no, I just couldn't." Those words like really hit me right here. And I said,
Mm-hmm.
"God, you have to give me the strength. I need strength to get through this, to fight every day, to push myself, even though I know how much my body was really hurting me.
Mm-hmm.
But I have to be strong for my boys.
Mm-hmm.
They need me." And little by little, that's how I kind of pushed myself to just
Yeah.
try to fight this. Because I always say I have fibromyalgia, but fibromyalgia doesn't have me.
Love it. Love it.
So I called a counselor, and I met with a counselor, and she was helping me cope.
Good.
Because it's like she says, grieving is not just losing a parent or a family member. Grieving is also losing a job. Grieving is losing your health. Grieving is losing so much in life. And I was grieving the loss of work, the loss of me being the normal, and now
Right.
trying to figure out how was I
Moving.
gonna move forward with how my body was at the moment.
Right. Right.
Getting ready to, I won't say at that moment, but in a few years down the road, I knew my mom was gonna go. I lost my mom, and trying to process that and know that in a few years, like, her days were pretty much counted. So all of that was
Mm-hmm.
all grief. And then, of
Right.
course, my marriage. So
Right.
I went through all of those losses,
You sure
and she
did.
helped me.
I'm so happy that you mentioned about therapy, because that's basically a therapeutic environment for you to have support, for someone to not judge you, to process, like you said, all those different things. Even though this has been difficult in your life, it has definitely been a season of challenge and pain. How has it made you better, or how have you actually gained something from it?
Well, number one, I've always been a strong person, so I think I became even stronger. I know I can deal with whatever's thrown my way. You know what I
Mm-hmm.
mean? It's a blessing because I've met so many beautiful people, and here I
Mm.
am. I met you.
Yes, yes, thank you.
um, I've been able to share my story. So to me, it's a blessing to be able to be a voice to other people. It's not that I'm stronger than that one or this one. It has nothing to do with that. We all handle pain. We all handle things differently. I feel it's so important to be a voice. So to me, that's one of the biggest blessings, just being a voice to other women, other men, because men go through it as well, that wish that they can do that. I know so many people in my hometown who haven't, who never spoke about it. And do you know that ever since I started being open about it, now they speak about it?
I believe it.
Yeah, so
because they're not alone.
They're not, and that's one thing, you know, people need to know they're not alone. People need to understand that there's going to be someone who's going to judge no matter what it is that you do in life, whether it's good or bad. So what are you going to do? I mean, I've grown into a bigger and better person because maybe a few years ago I would take that personal. Somebody judged me. Now I don't, you know, I don't. And guess what? I'm going to continue using my voice to help whoever, because there are people who are suffering in silence. There are people, and this goes with everything, you know, there are so many people out there that wish they had the strength or that feel embarrassed, because that's one of the things, because fibromyalgia is, like you said, there is no test. It's invisible. There's no test. And because we look a certain way, people are going to judge you. So many people hide what they are going through or what they have and are not open about it because they're afraid that this one's going to judge me because of how I look. And it shouldn't be that way. You know, you should be able to voice, because nobody knows what you're going through. Nobody knows your pain. Nobody knows your suffering. And that's how I did. It was a blessing because, like I said, even using my makeup skills, I actually did. And I don't know if you saw my post where I brought awareness to fibromyalgia.
No, I didn't. You have to tag me on that.
I will. And it's actually a post where what I did was, you can't see my physical scars. You can't see, with fibromyalgia, you can't see that. I'll give you a perfect example. I had someone who had mentioned somebody who had lupus. And because the person had, mind you, I did test positive for lupus 2 times.
Really?
Yeah. So the doctor said that I have to keep getting checked, just because you never know if it's underlying. So she wanted to put me on some steroid medication, which right now I don't want to do. Because it comes back positive, then it comes back negative. So I don't want to feed my body with other medication.
Like what things that you do to help you with like the symptoms?
A lot of heating pads, a lot of the sauna at the gym, rest. A leave, you know, once in a while. So that helps. And just eating, just changing my eating habits, because there are a lot of foods that we eat flare you up. I don't know if you've ever kept track of that.
Absolutely.
I started journaling it.
Absolutely.
Yeah, I didn't know that.
The white sugars, wheat, and for everybody it's different. So that was good that you went to an allergist, because there can be things that you don't realize that can be flaring you up. So it's very good to document your symptoms, document what times of year, what time of day. Do you notice your symptoms get worse around the cycle time or like a hormonal connection?
Well, I'm going through hormonal change right now, so I'm actually menopausing.
Okay. But even before that, did you find that the symptoms intensified around that time at all?
Yeah, of course. Even when you're getting sick, you know, like you feel flared up. Like when it came to going back to the whole lupus and fibromyalgia, I remember clearly someone talking to me about this. Mind you, I have a chronic condition just like this person, and you know that the symptoms are very similar. But I heard this person saying, "Oh, I feel sorry for this one because she has scars, and I feel sorry for everything she goes through, and I feel sorry." But I was looking at that person, and I'm like, but wait a minute, what about me? I told it just like that. I'm like, what about me? I don't have any physical scars, but I have literally the same condition, you know, kind of, you know, same symptoms. What about me? Like, I don't need anybody to feel pity for me, but have a little bit of sympathy, some compassion, because I go through that as well. For someone to say, they just kind of took a step back and like, oh, you know, my pain does not have to be physical for people to know that I go through that.
There's so many things that we go through in this life. Even if nobody is sick, you know, there's things in their life that they're dealing with that we don't know. That's why it's important to be kind and compassionate, because we just don't know. But it can be very frustrating when you are suffering internally. No one can see it. And you do feel this like left out feeling, or feeling like what you go through is minimal because it's not seen. You know, I just called my rheumatologist today. I want to get a prescription for a cane for when I have
Okay.
flare up to get up and down the stairs. And what would you say to those who say to you, there's people who have it worse, or like try and minimize how you feel? What do you try and tell yourself in your mind so you don't let that like minimize what you go through?
What I feel is real. Like this is, I know what I go through. I, even though you question yourself and you're afraid to sometimes say, I do have a problem. When you overdo it and then bam, you're reminded the next day, okay, you have a condition. You need to take it easy. And this is where my problem is. I do too much. And then the next day I'm like, it knocks me out. I am reminded right there that I have a condition that I question sometimes. It's just hard to, it's hard to even put into words, because just so many people just don't understand it. They just don't get it, especially if you're strong like yourself and like myself, and we carry ourselves the way that we do. People just don't get it.
What would you say to those two people? For those who don't understand what it's like, what would you tell them not to say to someone who has an invisible chronic illness?
The first thing is, please don't go up to somebody and tell them that they don't look sick. That they don't look sick, or that fibromyalgia is in your head, that is not real, that there's no diagnosis for it, that, oh, but you'll be fine. You got to eat better. You got to stay fit. You got to go to the gym. Not everybody is the same. Everybody is different. And although I like to work out, I know how hard it's been for myself, who is strong. I have very high tolerance for pain, and not everybody does. That's the other difference. So if you have high tolerance for pain, you can probably handle things better than others. With certain things that I have, I mean, I know other people who just want to be in bed all day. So just don't tell someone that they can do it, that, you know, it's not real, that they look okay, that, oh, but you don't look sick.
What would you say that they could say instead? Because sometimes, honestly, I think people say it unintentionally. They come off because they don't know what to say. So can you give them some things that would be more encouraging to say to someone?
Well, if you come across someone who has a chronic condition, fibromyalgia, any type of chronic condition, I would say you're not alone. I'm here for you if you need a friend. I don't understand what you're going through, but I can sympathize with you. Maybe we can sit down and talk, and you can fill me in on what it is that you feel, and maybe I can find ways to help you, or we can both do research together, and maybe we can come across some type of solution. They just need to be more understanding. They need to educate themselves as well. Education is important. There's Google. There's Google. So go educate yourself. Go read. Go maybe get together with that person, like I said, and have a meeting, and just listen to them. Sometimes, you know, all you want is to be heard. You just want somebody to just listen to you, instead of saying, I know what you feel. I have the back pains too. I have the headache too. I want somebody to hear me out. I want somebody to just zip it for a second and say, you know what, I'm going to be your friend today. Or you know, if I'm your friend, I'm your friend, period. But I'm just going to be your friend, and I'm going to listen. I just want you to just to vent to me. Just tell me how you feel. Cry if you need to. You know?
Even saying that must be hard.
Of course.
That must be a lot to deal with, or you're so strong, or it's good to see you. You know, maybe someone hasn't seen you in a long time, and that's where the whole, oh, but you don't look like you've been sick. And it's like, oh, it's nice to see you. You know,
exactly.
I think that'll be good to give people something. So also, what would you tell those who are chronic warriors, who are just like you? What encouraging words would you give them?
I would say, again, you're not alone. We're in this together. I would say you got this, because we got this. Do not give up on yourself, you know, to take it easy, to listen to your body. Listen to your body. I think is one of the most important things that we need to do is listen to your body. Don't be so hard on yourself. If somebody judges you, I mean, I would say try to brush your shoulders off and just say, you know what, they just don't get it. So just be good to yourself, be kind to yourself, be patient with yourself, be understanding. Nobody knows you better than yourself.
And I love that since I started this page, something that I've continued to say is rest is productive. Because as women, as moms, we can get so wrapped up in what we have to do. And it's important to know that when you rest, that is productive, because if you do not rest, you will be in flare-up. And when you're in flare-up, it's harder to get back up. Now, sometimes you might overdo it, and sometimes it's worth it. You know, you have to count the cost. Sometimes we make an effort for a special event, someone we love, for our kids, a special event of theirs. But then we have to understand, I don't know if this happens to you, we're like, oh, why am I so, like, well, I just did this thing. So we have to understand we need more recovery than most people. So like you said, listen to your body. And I feel that that's actually one of the benefits of fibromyalgia. You are more in tune with your body. Sometimes that's good, sometimes it's bad, but it's good in the sense that your body will let you know, even when something doesn't feel right, when your boundaries are being crossed. When we don't listen, our body finds a way to let us know. So I found that with a lot of these conditions that they can't find something for, it's some kind of alarm system letting us know that,
definitely,
right?
it
And
goes off in your body, you know, the stress, actually, you can feel all that flare up coming.
Thank you guys so much for watching. Please let us know in the comments, if you are a chronic warrior, what it is that you experience. If you have any tips on coping, we'd love to hear that. And I will see you guys on the next video. Bye.
Bye.
Okay.